But I think work ethic really defines people.
Yeah.
You know, I really do. I think it's the number one attribute. I would take a kid with massive work ethic than a kid with natural ability, because I know I can rely on those
Yeah.
guys.
Yeah. 100%.
Mm.
Yeah. And so how are you using that mindset and your leadership skills that you've learned over those years today in these clinics?
So I think the good thing about like the urgent care thing and growing up, as I did, one, obviously work ethic, two, never giving in, three, I developed a structure of how I arrange things, because learning's like this evolving sort of thing. When I learned through med school, a lot of it was rote learning. I couldn't remember half of that. I didn't know how to learn.
No.
That's the only thing I could do. It's just memorize stuff, and I didn't even know what it meant. And then as I got more into stuff, I realized actually, if you really understand what it means, then you'll remember it. Right? So the structure for when I was the clinic director about how to run businesses, I was junior, but we had senior directors, and I was gleaning information from them. And the structure on how to sort of have patients come in and diagnose them and have all these other ancillary services, they gave me a really good grasp and understanding of sort of how some businesses could work. So I took that information and sort of tried to develop my business like that. So for instance, when I was working in urgent care, I was working on my business. So, for people out there, when I hear what you say, but you're a doc, you earn money, and I'm doing something that doesn't pay much. How can I move from one thing to the other? Well, I'll tell you what you do. You do two things at once. So I was working urgent care and I was building this business, right?
Yeah.
And it took me years, but I did it.
Yeah.
And my income, urgent care was here because that was my primary income, cosmetic medicine and men's clinic down here.
Eventually.
And then over time it went over,
Yeah.
and then I let this go. But it took years.
Yeah.
And I flogged myself. We raised 5 kids, doing the urgent care doc thing, the clinic director thing. We're trying to build a business. So it was a bit of a haze, but you get there.
Yeah. And it's about not putting all your eggs in one basket, right? And it's about having multiple sources of income.
You've got to have multiple sources, because if one thing dries up, then you're in the stock a little bit, right?
Yeah.
So I was saying that. So I recognize that with what I'm doing now, that is, if I just did cosmetic medicine and there was a run on cosmetic medicine, and there is because of the economy, so that's discretionary spend, then we suffer, right? So I quickly pivoted and developed a men's clinic for men's sexual health needs, and I've also got a hair clinic, and they all run pretty good. We've got stuff, it's like shares. We've got different things. If we light on something, we'll do okay on another. So if you can develop multiple income streams within your business model, it's really protective.
Yeah.
And we have everything on one site. Well, that makes sense, doesn't it? We've got one footprint, we pay one set of lease, but we have 3 different websites, 3 businesses. We have window front